How can PID be an asymptomatic infection? Pelvic inflammatory disease can sometimes be silent, meaning a woman might have it without feeling any noticeable symptoms. This happens because the signs of PID can be very mild or even completely absent in some cases. Usually, PID starts with bacteria from sexually transmitted infections like Chlamydia or Gonorrhea that travel from the vagina through the cervix into the uterus, fallopian tubes, or ovaries. The body's immune response may not always cause obvious symptoms, especially if the infection is mild or caught early. There are several reasons why PID can be asymptomatic. One is that the inflammation caused by the bacteria might be very mild, not enough to cause pain or discomfort that a woman would notice. Symptoms like pelvic pain, unusual vaginal discharge, fever, or painful urination can vary widely. Some women might only experience vague or nonspecific symptoms that they might dismiss or confuse with other issues. Another factor is how each person's immune system responds. Some women's bodies may not produce the typical signs of inflammation even if they have an active infection. This means they might not feel any pain or notice other symptoms. Also, PID can develop gradually over time without causing sudden or severe symptoms, which makes it easy to overlook. Without symptoms, the infection can continue to cause damage to reproductive organs, leading to scarring, infertility, or even ectopic pregnancy later on. Because PID can be silent, many women don't realize they have it until they experience complications or undergo routine screenings. That's why regular testing for common bacterial STIs like Chlamydia and Gonorrhea is so important, especially for women under 25 or those with multiple sexual partners. Healthcare providers often diagnose PID based on pelvic exams and lab tests, not just on symptoms. They might find signs of infection during routine checkups or STI screenings, even if the woman feels perfectly fine. In summary, PID can be an asymptomatic infection because the body's response might be mild or absent, yet the bacteria are still causing inflammation. This silent nature highlights the importance of regular screening and early treatment of STIs to prevent serious reproductive health problems. If you're sexually active, especially if you have risk factors, talking to your healthcare provider about screening is a smart step to protect your health. Always seek personalized medical advice if you have concerns or questions about your reproductive health.